I see this as AARP, and then they say it's sponsored. It's a supplement to Medicare, and what confuses me is that the way I understand it, United Healthcare is the private health insurance that sponsors that supplement. Now, does United Healthcare get a supplement from the government? Tax money?
Yes. Yes.
That's like a lot of money, right?
Yes.
That can be saved, but I hear Republicans talking about they're taking money out of Medicare. In other words, they are really not taking money out of Medicare if they take that supplement from the private insurance companies away. Right?
Well, what we're trying to do is trying to figure out if we're going to provide, or if there's going to be a way to have health coverage for those who don't have health coverage now. How do we do this? It has to be paid for. So the pay-fors that we have so far through voluntary discussions with the different organizations is the area you're referring to, and that is a program called Medicare Advantage. And what that does is private companies administer your Medicare program for you. And for that, they receive a 20% premium over the average Medicare cost. And what's been put forward is that premium to a United Healthcare, for instance, will be reduced to 12%. That savings of the 8% will help to provide $156 billion in savings, and those funds can be used to produce health care. So that's the process you're talking about.
Thank you.
Yes, sir.
Yes, I'd like to say that I support the idea of universal health care and Obama's plan. And the reason that I do that is that I've seen that Medicare has been a very successful program. And that
you know, let me just say right now, on both sides, the applause or lack of applause, I do high school graduations, and at the high school graduations they always say, if we can just hold the applause till the end, then we'll get through this. Otherwise we'll be here till Wednesday morning. And so if we could just listen to everybody, that would be the greatest. And if you brought an air horn, because they've been at all the high school graduations, I'm just kidding on that. But if we could just work through this, you know, you may think that's the worst thing I've ever heard, but please vent in the car. Go ahead.
Yeah, I'll be real quick. But I like Medicare because my father is 96 and a half years old, and he's benefited greatly by the Medicare in terms of costs and reduction in his payments to the hospital, which are a necessity. And so that by adding additional health care for other people, I think that's very beneficial. What you said earlier was that 78% of the people coming into the hospital in South Bend either have no health care or
on Medicaid.
On Medicaid, yes. And a friend of mine that's a doctor at the University of Chicago said that when people come in that way, then the hospitals have to raise their costs for the rest of the people because they've got to compensate somehow.
Well, that's how you wind up with $8 aspirin.
That's right. So by having health care for people that are now uninsured ought to reduce costs for us at the hospitals. So I think that's a good thing.
Okay. And what we're trying to do, for instance, with Medicare, and I bring that subject up because it's been kicked down the can's been kicked down the road for so long that we have a big debt now. We've got to sit and say, okay, we can either pretend not to do something or do that, fix this. And so, as I said, we have a number of options. And there's 6 bills kicking around right now. The one thing I do know of the 6 bills is that none of those 6 will become the law that passes, if anything passes. When we go back, there'll be continued discussion. People will continue to work together, and then they'll start working on something that may combine certain elements of each one. But that's the process that's moving forward right now. So, yes, sir.
I'll speak loud enough so everybody can hear me. I want to know your comments and your feelings in regards to the government-run agencies that are already on the books, such as Amtrak, the Postal Service, two, main one. Are they making money or losing money? Are we subsidizing them, and how long are we going to continue to subsidize those two forms of government and then try to take on everybody's free lunch, such as health care? We have to work. You have given away our country's jobs through your NAFTA program.
Sir, if I could just stop you for 1 second. I've worked in the private sector for the last 30 years, up until the last 2.5 years. When you tell me I've given that away, this is not my government. This is our government. That's why we're here today.
Okay, so what are your feelings on regards to, we've tried to push away, and I've already read that we're trying to get a high-speed Amtrak between here and Detroit. People don't use the Amtrak now to go from here to Detroit. What makes you think that we're going to do the high-speed rail and spend that money on a high-speed rail and get any more followers or any more people that are going to use it? Balanced budget.
Can I answer your one, and then we can try and get back to you later on, if that's okay?
I have many questions, and I want to talk to you after the meeting.
That's fine. I have over 100 people here, and I want to give everybody an equal chance to have their voices heard, is what I'm trying to do. So, I don't disagree with you that those things, the Postal Service, we're in a position now where the Olive Street Station is closing down in South Bend. The announcement came out just the other day. It is an organization that has to run and balance itself out. If you'd like to close the Postal Service, you know, that's something that can be discussed.
Joe, we wanted to run...
Well, let me finish, okay? I know you wanted to run and balance its budget, so should we put in 2-day-a-week service? Should we, instead of a letter being 40 cents, make a letter $6? I mean, those are things that have to be discussed. Up until it's really exploded the last 3 or 4 years with the Postal Service. And Amtrak, you're right, there's a subsidy that's given there. The value of the subsidy has been, it's been determined that the value of the subsidy is more valuable than the cost that goes into it each year. That's been a decision that's been made every year. There's no passenger trains in the entire United States that make money. If you like the South Shore loses millions of dollars every year. It had its highest ridership in history this past year, over 4 million riders, and still lost money. And so then there is a contribution by the state, by the local governments when they make a determination. Are those funds that have been spent on that, are those funds that would have been spent on the roads or on something else, and does it have enough value to our community and bringing people here who spend money in Michigan City and elsewhere, that it offsets the cost that it's been. So